kind of help you understand how the changes in behavioral health will impact providers and members. All right, now I am going to share for care management so we can get that going. All right. I'm going to go ahead and turn it over to our Providence team. It's either Mel, Rochelle, or Dustin that will be presenting on the care management topic. So I will turn it over to them for introductions and sharing.
Right. Thank you, Sarah. And this is Dustin Howard. I'll be the one walking us through this document, but I'm wondering if the group might be interested in hearing introductions from the three of us. But I'm Dustin Howard. I'm the Director of Behavioral Health Services, primarily overseeing our clinical programs. I'm a licensed professional counselor. I have been doing managed care for quite a number of years. And Mel, if you're ready, if you'd like to introduce yourself.
Yeah, good afternoon all. Mel Top, Director of Healthcare Services with oversight over our care management and our concurrent review processes for YCCO. And our team shares this role with Dustin.
And Rochelle, if you're available.
Yes, good afternoon, everyone. My name is Rochelle Morley. I am one of the managers with Providence Plan Partners, and I have oversight over our YCCO team on the physical side of our house and work very closely with our behavioral health team.
All right, thank you both. So I think our intent was to cover this care management document. I think we've gone over this before in another setting. I'm not sure if it was this one or not, but essentially this is the behavioral health case management information form that we have been augmenting specific for the YCCO population. So I'm not exactly sure if we're looking for final approval here, if that's our intent, or if we're just walking through this to do a show and tell.
It is a show and tell, just to kind of let our newly contracted providers and those that are going through this transition as well, that might have been previously contracted providers, understand how they can access care management services now that these services have been handed off to Providence and are no longer fully handled through YCHHS.
Okay, great. Thanks for that. I want to make sure to stay relevant to what you're interested to hear. So what I'd like to do is just talk a bit around this form to explain some of what we actually do in the care management space. And I'm aware that all of you have had some exposure to case management and have familiarity with that, but I'd like to be more specific to behavioral health and what we do. So within our care management program, you'll see in the box here with the prioritized population for the care management services, there's quite a number of things that we do. And we're fairly all-inclusive in who we take in for case management. Anyone who surfaces with a behavioral health need is struggling to navigate the behavioral health continuum of care, which is many people. And folks that have surfaced with, utilization of higher levels of care are all folks that we do target and identify for care management. And we do prioritize that based on the prioritized population, which is all listed here. So I'd like to just take these bullet points to talk through some of these. Some of these are a little bit more involved than others, but we'll rock through here. So the one type of care management program that we have is what we would consider our complex population, whether it's adult or children. And these tend to be members that have multiple admissions to behavioral health care. Maybe they have medical comorbidities, but their behavioral health condition is taking primary, or their behavioral health condition is causing them to not take care of their medical condition. These are folks that we do try to surface and either manage that primarily in the behavioral health space, if that's what the current needs are, or we work and co-manage the member with our medical case managers to ensure that that full member's needs are getting addressed all around in a more holistic fashion. Oftentimes, these are individuals that are coming to us after multiple inpatient psychiatric discharges or for substance abuse, residential treatment, or have had multiple stints and it doesn't really seem to be working for them. We will do more hand-holding with those individuals. We do some coaching on self-management skills and helping to ensure that they have the resources available to them to actually manage the condition on on their own, and that they have the appropriate clinical support surrounding them to help them succeed in managing their more challenging behavioral health condition. We do target members who are diagnosed with a serious emotional disorder or a serious and persistent mental illness. And there's quite a list of diagnoses that would go into this. I'm sure that none of them would be a surprise to you, but we do particularly look for those that have, a diagnosed mood disorder, bipolar disorder, major depressive disorder, or it could be things like, psychotic disorder, schizophrenia, anything that would be a bit more persistent in their life. We do try and identify those out of the population to ensure that we're reaching out proactively and offering the supportive services and ensuring that they're getting connected to those things that they need to be connected with. IV drug users in need of withdrawal management is another population that we work with, and this really surfaces in our identification of substance use disorders in general. So we do look for individuals who have accessed higher levels of addiction treatment. Oftentimes that comes in the form of detox and residential treatment to start. And then we will help with the care navigation for the subsequent step downs and ensure that they have sober support surrounding them. We're looking at ER utilization data. So individuals that might have presented to an emergency room for an overdose, particularly an opioid overdose. Those are folks that we are actively reaching out to. And while there really isn't a specific coding to let us know that there's an IV drug use at hand, we know that is happening. We assess for that once we get them on the phone. So helping them get connected in with medication assisted treatment as is appropriate. And then this other box, I'll cover these fairly briefly, but we do assist with the care transition support. So as individuals move between the different levels of care, all the way from inpatient to standard outpatient treatment, on our utilization management side and case management side, we are working together to ensure that those transitions are smooth, authorizations are in place, and if there's any barriers to the person accessing that next transitional level of care, we're working together to ensure that we help to get that resolved so that they don't fall through the cracks. Care coordination falls within that same definition. As people are raising their hand and looking for care, then we will help them find the appropriate care. If that requires, specialty programs and that type of stuff, then we'll help them to locate those. Autism and ABA, is a standard part of our program in helping parents navigate for their children. We do have some more targeted eating disorder identification and coordination of care that we do, which can be a challenging and more persistent population. And so we do quite a bit of hands-on work with those that are in recovery or working towards that. Addressing any social determinants of health that are identified in helping folks get connected with community resources, targeting folks that have the high ED utilization and then high cost, which generally comes in the form of utilization of higher levels of care, and anything that falls in between. So here, I'm not going to read through all of these. I think I had spoken to much of this in my previous description, but our main objective is, one, to ensure that folks are getting connected to appropriate care, that they have someone in their corner to help them overcome barriers, but we also want to provide some level of education and coaching just around what it means to have a particular diagnosis, how do you manage that particular diagnosis and symptoms that might come along, and then helping folks overcome barriers as they present themselves, as they work towards their recovery. So there at the very bottom, you'll see this is how to reach out to us. If there's a member that a provider might be working with, even if it's an outpatient in an outpatient setting, but the member is experiencing a number of different challenges and could benefit from support, this is how they could get into contact with us directly, or the provider could also make that referral directly to us, and we would be glad to reach out and collaborate and offer whatever support that we can.
Great, thank you so much, Dustin. And just so you all know, we will be providing a copy of this via email at the end of this forum. So any materials that are presented will also be sent to you via email. So does anybody have any questions at this point? If we want to raise your hand, we can kind of go through, or you can feel free to type the question in the chat and we can review it there as well. All right, so seeing no questions, we'll move forward and move on to our next topic, which is community health workers. Let me get that up for you. Right, hold on, I'm having trouble pulling the document up.
I'll go ahead and introduce myself, Sarah, while you're
Okay.
doing that. Is that okay?
Yes,
All
that's
right.
perfect. Thank you so much.
Sure. I'm Michelle Dignan, Member Engagement Supervisor and Social Worker with the Health Services team at Yamhill Community Care. Just wanted to tell you a little bit about our CHWs today and some of the things that we do, where our referrals come from. Just to start there, from you guys, actually, from PCPs, from clinics. We have referrals that come to us from school counselors, partnering agencies, foster care, mental health counselors. We receive referrals from the whole community and even self-referrals as well. So this is just a really quick and good description of what CHWs do. They're helpers who understand special needs. They're in the community. They know the culture of the community, which we love that. And they provide connection and social services and referrals all over. So our hub actually triages case by case, and sometimes the point is to actually lay eyes on a member, an individual that is very difficult to get a hold of. So that actually has been one service that our CHWs can provide. But most often they're helping in the roles of connecting them to the services that they need. Sometimes it's intensive, and sometimes it's a really quick referral to somewhere else in the community, or often it's just assisting them with finding what their health benefit offers and getting them dialed in there. let's see, the other thing I like to highlight are that our referrals are definitely for stabilization of health, looking at social determinants of health and seeing what chronic or complex health issues can be assisted by their health plan. We often, well, actually, we see high-risk pregnancies, foster children. We see people who are needing some coaching in just learning how to access the resources or find the forms that they're looking for, or sometimes assistance in filling those forms out and getting them submitted. But ultimately, the coaching that happens seems to be the very most supportive part of what our CHWs do for our members, is just to help them stabilize a little bit, along with finding that resource assistance and being able to do what they need to do and learn it. So we love that. Our CHW we have right now is Esmeralda Fajardo. If you've ever met up with her, she's absolutely lovely. And we are hiring at this time our second community health worker. So that's some information that hopefully will be helpful to all of you. We do have on that right here, just that link that you can click and find our most recent hub referral form. And what I would say, the best results we've had with between our CHW and our whole hub, health hub, and clinics or primary care is the coordination of efforts between member, clinic, and CHW, having great communication, follow-up if necessary, really assist that member. And the biggest thing that we've seen to be a huge help is to let the member know that the referral is going to happen and get not only their permission, but their buy-in, I would say, in wanting the assistance from a community health worker. So we've worked, I could name a few different ones that we work closely with here in McMinnville. There are many other ones, but West Hills, we've worked closely with and had great success for members, Sunrise as well. But then there's been others in Newburgh and outside the area, just of where we reside. The rapport that's built between the staff and the CHW really does make it more effective for the members. So we encourage that. Let's see, some of our partners that we consistently are working with would be, examples would be YCAP, Love Inc., Provoking Hope, our Bob team with Providence, Lutheran Community Services, the Lions Club, DHS and NWSCS, Northwest Senior and Disability Services, and many more. But we're so happy to always partner with them and to find access with our members, what they're needing. I am open for questions. That was the bulk of the material I wanted to share. Does anybody have any questions, or has anybody had a great experience utilizing our community health workers? It's a quiet group today, Sarah.
It is a quiet group today. If you do have any questions, again, you can feel free to put them in the chat or raise your hand, and we'll be happy to call on you for any questions. This really is a time to get to know some of our programs, really understand them. But again, if we're shy in this room, that's okay. And you can always reach out to myself or Michelle if you discover that you have a question later on.
That'd be great. My direct line is on the Health Hub referral form. Thank you very much, everyone. I appreciate those of you who've utilized our services.
Thank you so much. Oh, wait, we do have one, a question in the chat. Does the CHW do wellness visits?
Let's see, I'll have you clarify wellness visit. What our CHW does is assessment. So definitely an assessment either by phone, telephonic. The in-person would be after assessment. If there are in-person, if there's an in-person visit necessary. And with COVID, it's usually outside still at this point and in a public place often.
We have another question. What is the current wait time
Sarah?
to see
Oh.
CHW?
Real quick, sorry to wade in, but just to clarify, sometimes we run into language things with behavioral health. Just to clarify that the CHWs wouldn't be doing wellness checks like you would expect police officers or crisis teams to do.
Oh, thank you for that
Just
clarification.
to differentiate, because wellness, you know, they can start to run together.
Thank you, Deanne.
Thanks
That's a very good point.
The other question we have is, what's the current wait time to see a CHW?
We usually respond to a referral within 24 hours. You'll get an answer that we have received. They're put in queue, and the usual wait times would be usually 3 business days. There's a contact within 72 hours, business day. And then at that point, it becomes up to the member of how much engagement is going to happen. But if they are engaged and have an assessment, they usually will receive help within the week. That's still about our timeline.
Excellent. All right, and if we don't have any other questions at this time, we'll move on to our FamilyCore presentation.
Yeah, so Sarah, while you're pulling that up, my name is Jen Jackson. I work here at the Yamhill CCO. I'm the provider relations specialist. And while I don't currently sit on a role where I manage the FamilyCore program, I did in a previous life, in my previous role as the CCO. And the current position for the person who actually manages this program, that's an open position. So we're currently recruiting. So I am here to let you all know what FamilyCore is. FamilyCore is kind of like, you know, that support for families where Michelle talked about support for an individual member potentially. So FamilyCore is a community based organization. Although Yamhill Community Care and the Early Learning Hub staff this group, it's really a community owned group, and they have their own Facebook page. On here are the partners that we partner with within the community, just a few of them. FamilyCore stands for Coordinated 0 to 5 Referral Exchange. So it's a way for a provider, when you see a member who's either expecting or has a child up to the age of 5, who struggles with any of these risk factors that are identified on this referral form. I'm sorry, this is so tiny. Hopefully we can send these out. But somebody who's a teen parent, a parent who has developmental delays, or a parent of a child with developmental delays, you can see all of these, you know, safety concerns, substance abuse concerns in the home. It was brought up in our community several years ago that there's all these places you can go to, you know, public health or a family place, but providers really didn't know which families to refer where and who had wait lists. So we developed this kind of community referral exchange program. You can fill out this form. The next slide has the website to go to where you'll find this form. And then the community groups meet once a week, and they kind of then would pass this to the appropriate agency to serve this family, whether we feel like the family would be best served by a relief nursery and they need really intensive home visiting, or they might benefit from a Head Start classroom, you know, or the child isn't gaining weight or isn't meeting developmental milestones, and maybe we need to have a nurse go out from public health and kind of talk to the parents and do kind of that ages and stages questionnaire and figure out where the child is developmentally. So those are that's kind of what FamilyCore is. If anybody has any questions about how that program works or how to get a family connected, they're all home visiting services, quote unquote. But right now, a lot of services are still being delivered virtually. However, I do hear that most Head Start classrooms and relief nursery classrooms are open in some capacity right now. So there are classroom opportunities, not just virtual kind of phone appointments and things.
All right, thank you so much, Jen. Does anybody have any questions? Again, you can feel free to raise your hand or put those in the chat, and we'd be happy to answer any of those that you have around the FamilyCore program and how you can access that for your patients and our members. Okay, we are moving along on this topic. This is great. We're going to have plenty of time for Q&A at the end if people have general questions about how the transition's going and things like that. So we are at our just open question time, really trying to get a feel. I know we're only 5 days into this transition, so this is an opportunity if you have questions, concerns, anything like that. We have our director here, Deanne, who's able to answer quite a few questions. We have our folks from care management here as well. So I'm just going to go ahead and open it up for any questions, comments about the transition. And then after that time, we'll talk about our upcoming forums and what those topics will be.
You know, while folks are thinking about questions they might want to ask, you know, I could talk a little bit about some of our activities. We've certainly been doing a lot of work on transitioning certain functions, and you've heard about care management. And, you know, obviously, as more people, some of you are already contracted, which is a change in status, and the ability to use SIM, all of those things. So we've had a fair amount of conversation around that. I think some of the other things we're really looking at is how are we as the CCO supporting our provider network? One of the areas that we're just, you know, starting to dive into is really to assess training needs. You know, I'm an LCSW, so, you know, I've got to chase those CEUs on it every year. And I know that many of you have those needs as well. And so as we begin to look at that, not only for CEUs, but, you know, which those are wonderful, but also what are the training needs that our provider network has? What are the, you know, skill sets that people would like to continue to develop? And how might we begin to have trainings throughout the year to really provide some of those supports for folks? And so those are conversations we're having, we're thinking about. We're certainly, I welcome feedback. I'm sure that, you know, there's the basics, such as having an ethics training and the minimum CEUs folks have. But beyond that, you know, what's missing, you know, what's easy to find, but what's more difficult to find, you know, and what would help people feel supported as they evolve as professionals and things like that. So it's not all, you know, it won't all be about SIM and et cetera over time as we have ongoing discussions. Obviously, we want to make sure we get those foundations in place and make sure that you have the knowledge and skill to navigate the different systems. But we also really want to make sure that we have a vibrant provider network that works together and that we're able to hear people's voices and input as we continue to evolve.
And again, if this isn't a space where it's easy to come up with your questions and things like that, I wanted to let you know I did put my contact information in the chat. So if something you're like, oh, I should have asked that, feel free to email me and we'll get those questions answered for you. If you think of a topic, like Deanne said, and it comes to you after this meeting, don't worry about it. You can just reach out to me directly and we'll be happy to get that information to Deanne and work on that. I did want to go into our forum, our future forum topics, hoping to really support you guys as we move through this transition and provide the best upfront service to our providers that we possibly can. So our next forum, all of our forums will be at the lunch hour. We've found through our previous SIM training that most of our providers have availability during the lunchtime to do these quick forums and touch base. So each one will be from noon to 1. Our next one will be January 19th. And our topics are going to include what timeliness to care looks like at the different levels of care. We'll be discussing language access and the new language access tracking code that OHA has started requesting of the CCOs to use, so we can ensure that we are providing appropriate services, culturally and linguistically appropriate services to our members. Our next forum after that is going to be February 2nd from noon to 1. And those topics include authorizations and the PA grid, giving guidance on what requires authorizations, what authorizations we can expect to have auto approved, and what ones need to move through the medical necessity review. And then our final forum will be on March 2nd. And that's going to be we're going to be further into this transition. So I think a lot of our providers, if they're running into any issues, any barriers, this is really going to be a great opportunity to kind of have that general topic. So we will go over SIM technical assistance at that time. We did have SIM training prior to the transition, and we do have that recorded. So if you weren't able to attend that, I can most definitely send that to you. But this will be a technical assistance and refresher time, as well as a time to just discuss any other questions you may have as you're moving through providing services to your patients and meeting their behavioral health needs. So I appreciate you attending this forum. Invitations will go out to those as they get finalized. So be looking for those from our provider relations email box, just as you received this one. If you have any other questions or anything, please let me know. Otherwise, you will get back 20 minutes of your lunch.
Thank you, everyone.
Thank you so much.